JC Fields, and today I'm going to be priming IV tubing. This is for the Peds lab with Mrs. Halter. Okay, so the first thing I'm going to do is I'm going to walk into the room, I'm going to wash my hands, and I'm going to explain the procedure to the patient, everything that's going on. I'm going to do my 3 checks and my 6 rights as always, and then I'm going to begin to get my supplies ready, which I already have everything laid out. Okay, so this is our fluids. So the first thing I'm going to do is I'm going to check for an expiration date, and then I'm going to check for any discoloration or any foreign particles floating around in there. This one looks okay, so then we can move on to documenting. Right here I have the patient's, it's upside down, but I have the patient's name, and I have the date and the time. I also have the infusion rate at which the physician prescribed. I also have the time of the infusion is starting and also the time that it should be ending. So with my clean hands, and I gloved up already, I'm going to take the protecting covering off of this right here, and then I'm also going to take the protective covering off of the spike. And whenever I take the coverings off of both of these, I'm not going to want to touch them with my fingers. So we're using aseptic technique. So then we're going to go ahead and spike the bag. Okay, bag spiked. Can flip it over and hang it up. Okay, so now once we have this done, we're just going to kind of inspect the tubing here, make sure that everything looks good, and we're going to also check for any air bubbles. We're going to get out all the kinks and everything. Okay, so with the tubing, we also have to document on our tubing because tubing has to be changed out. So right here I have my initials and the date and the time. So now that I have that and the clamp is closed, so I don't make a mess, I'm going to go ahead and open the clamp. I'm going to hold this over a little basin or over the trash or something. I want to make sure not to touch the trash or anything like that though. So I'm just going to open my roller clamp a little bit. So this will get the drops to start forming in the drip chamber here. We're going to squeeze the drip chamber a little bit and fill it about halfway full to where we can still see the drops. Okay. So now that we've done that, we can start all the way up here and work our way down, getting all the air bubbles out. So this first little port here, I can go ahead and invert like this. This helps get the air bubbles out. We can flip this to mobilize any of those air bubbles. Again here, we're just going to make sure that we have no air bubbles in the whole line. So we're inverting, we're inspecting, everything's looking good. Here's that last port I'm going to invert and flick. And then I'm going to check. Yep. So then it looks like all of our air bubbles are out. So I'm going to close the clamp. We're going to take the protective covering off of this and make sure that we don't touch anything. We're going to take the protecting covering off of our saline flush, again without touching it, touching the tip of it. We're going to connect these. Oh, just kidding. This is in our patient. We're going to not touch this, so we're going to swab it with alcohol, make sure it's real clean. And then without touching this or touching this, we're going to connect them. Like I said, this is in the patient's arm with the IV. So now we're just going to flush, and we're just ensuring that everything is good and hooked up correctly, and that the antibiotics will actually be going into our patient's arm and into their bloodstream. And then I will clean up all my supplies and wash my hands, make sure the patient is in a good, comfortable position with all the safety measures in check, and then hands are washed, so I'll exit and document, and that is how to prime the IV tubing.